Okay, so next thing أنا هنتكلم عن diaphragm. The diaphragm is basically يعني برضو a very high yield topic. It's always literally يعني في الامتحان it's like one question only, but it's a very easy question if you like studied it there. So it's always an easy mark. So I would not recommend that you go into an exam skipping the diaphragm. Usually the question is always about the openings of the diaphragm. So this is the thing we're going to be focusing on. But it يعني sometimes they could ask about other things. But for the diaphragm أول حاجة it's formed of two domes and it has a central tendon. So it has three things: two domes and a central tendon, right? You can look at the picture here. This is the first dome of the diaphragm. This is the second dome of the diaphragm. And this is the central tendon of the diaphragm. Well, the attachment of the diaphragm, it attaches to the sternum anteriorly behind the xiphoid process. It attaches to the ribs on the sides. And it also attaches to the vertebrae posteriorly here. It attaches to the vertebrae by using crura. Well, so crura are basically الcrus ديل. They're ligaments and muscles that attach the diaphragm to the vertebrae. Well, so it attaches to three things: to the sternum posterior, to the posterior aspect of the sternum, to the insides of the ribs, and to the vertebrae. يلا الكرورة ذاتها there's two: a right crus and left crus. The right crus, which is the one over here, it's basically on the level of L1 to L3, and the left crus is on the level of L1 to L2 usually. So as you can see, this right crus here, it reaches all the way here, while the left crus is only up to this point. يعني right crus is down lower than the left crus. Yeah, it's not that important برضو, but it's just good to know. في تاني ligaments as well in the arcuate ligaments in the diaphragm. Arcuate ligaments ديل هم thickening in the diaphragm في the bottom of it أو في the border حقه. So the important one is only the medial ligament, medial arcuate ligament. Why? Because it is a thickening of a psoas fascia. So it's also going to be mentioned في abdomen sometimes. Of course, sure. So in the ligaments, which are called the arcuate ligaments. The arcuate ligaments هم ثلاثة: medial وmedian lateral. But the one we're really concerned with is the median one. The medial one with the L. The medial one is a thickening in the psoas fascia, and it's attached not just to the diaphragm, but it's also attached to the psoas muscle, so the psoas fascia, which is why it's just important to mention, actually it's related to that. The other one's not that important. No? So if the diaphragm thickens, it becomes an arcuate ligament, right? Right. So basically القصة يعني the main idea of what the diaphragm is about generally. المهم في diaphragm is the thing that's most area of questions is the openings of the diaphragm. يعني there is no such thing as an exam where they wouldn't mention or ask you about one. If they didn't ask you in the paper, then they're definitely going to ask you in the DR, and vice versa. So it's very important to always revise diaphragmatic openings before an exam. If you just revise this slide, it's enough for you. You don't have to actually go and study the entire diaphragm. How to remember an openings in the diaphragm? There's this nice mnemonic that our DR teacher for semester 2 taught it us. I ate 10 eggs at 12. طيب يلا I is for the inferior vena cava و8 عشان تعرف إنه الcable opening is in the 8. بعد ذاك 10 eggs يعني is the 10th opening فيها eggs دي يعني agus, so esophagus vagus. Make sense? At 12 ال A stands for aorta وال T stands for thoracic duct, والاثنين دول في 12th opening. Make sense? So the eye is in the eighth, so inferior vena cava is in the eighth, and the things that end with agus are in the 10th, so the esophagus and the vagus. And then the 18 are the 12th, so aorta and thoracic duct. Does it make sense, Gemara?
Yes.
Okay, so basically this is an easy way to remember it. If you want to just memorize it the normal way, it's just that the eighth one is the cable opening, and the cable opening has the inferior vena cava, mostly. That the 10th one is the esophageal opening, and it also has the 2 vagus nerves, and it has other structures as well, like gastric vessels, left gastric vessels, برضو. I think it's not really asked يعني about. The 12th one has the aorta, and it also has the thoracic duct. So it's just the most area of questioning is usually these 3. And if they're trying to be tricky, they would ask about the vagus and the thoracic duct. أكتر من إنه they would ask about the vena cava or esophagus aorta.
Madam?
Or in the أيوة.
Sorry, my internet cut. Can you just repeat the last part?
Of course. The last thing we said is إنه the most important area of questioning is usually the openings of the diaphragm. إنه عندنا 8th is the cable opening, 10th is the esophageal opening, but it also has the vagus nerves, both the vagus nerves. The 12th one is the aortic opening, and it has the thoracic duct. And I said, if in the MCQs, they usually ask about the vagus and the thoracic duct more than they ask about these 3, because they know that these ones are easy, okay? And that we have this mnemonic to remember with it. So you say I8 10x at 12. I8 is that the inferior vena cava is in the 8th one. And XV, you remember with it that anything that ends in agus. So esophagus, vagus are both in the 10th. And the 12th one has the AT, which is the aorta and the thoracic duct. تمام?
Tamam, okay.
Right, the ones that are, it's very important to remember the openings of the diaphragm. Other things you could know about the diaphragm that you could come across is the innervation of the diaphragm. Innervation of the diaphragm is by the phrenic nerve to the lower intercostal nerves. The phrenic nerve is both sensory and motor innervation. And usually when they ask you about innervation of the diaphragm, they mean motor innervation. لو قال لك بس innervation, they're usually talking about motor. So the answer is phrenic nerve. If they mention that they're talking about sensory, then your answer should be phrenic nerve and lower intercostals. So the motor innervation of the diaphragm is only the phrenic nerves, while the sensory innervation is the phrenic nerve and lower intercostals. They could also ask you about the root value of the phrenic nerve. So the phrenic nerve comes from C3, C4, and C5. And the way to remember it is they say C3, C4, C5 keeps the diaphragm alive. It's just, if you memorize this, you'll never forget it. C3, C4, C5 keeps the diaphragm alive, which means that C3, C4, C5 is what innervates the diaphragm. Tamam?
But I have a question. When you say the opening the diaphragm, what do you mean? Is it the level of the vertebrae?
Yeah, it's the level of the vertebrae. So the 8th one is the level of the T8, and 10th it's the level of T10, well 12th the level of T12.
Oh, okay, thank you.
The sensory innervation is only the lower intercostal.
لا, السنسوري is the phrenic nerve معاها lower intercostal. لكن lower intercostal ما عندهم motor. تمام؟ the phrenic nerve is both sensory and motor, while the lower intercostal is only sensory. Right?
So the lower intercostals is a nerve?
Yeah, the lower intercostal nerves. For example, the intercostal nerve حقت 10th or the 11th or the 12th and so on.
Okay, thank you.
Any one of the ones that are at the bottom. You don't, they don't usually specify which ones, so you just say lower intercostal nerves. Make sense?
Yeah, thank you.
Tamam. Right. Any other questions? Right. Another thing that they could ask you, like في الorals mostly لو بيسأل في حتة تانية, is that the central tendon is also partially fused with the fibrous pericardium. So if they ask you in a central tendon, what else is it attached to? It's attached to the fibrous pericardium. So why? It's because they both come from the same place in the embryo. So they share an embryological origin. Well, this kind of question would only be asked like if you're doing really good in your oral and they're trying to be mean, but it could still be asked. You know, the central tendon is attached or fused with the fibrous pericardium because they have the same embryological origin. Come on.
يا مرام
أي question؟ أيوة.
معلش النقطة بتاعت الانرفيشن دي انت قلت الفرينك مع lower intercostals are sensory. طيب what is motor؟
الموتر هو الفرينك برضه.
أو
سامعني؟
يعني
أيوة، يعني الفرينك هو الاثنين. أيوة، بدي الموتر وبدي السنسوري، لكن اللور انتركوستال بدي السنسوري بس. تمام؟
اوكي فهمت.
عشان تتذكري حقة الموتر هم بيقولوا الجملة دي اللي هي انها C3 C4 C5 keeps the diaphragm alive، يعني هو اللي بيخلي الدايفرام يتحرك.
اوكي تمام.
تمام، دقيقة يا جماعة. Sorry يا جماعة. طيب. So this is so far a diaphragm. Is there any questions with diaphragm?
Can you repeat the diaphragm attachments?
Okay, تمام. So the attachments of the diaphragm, it attaches to three structures. أول واحدة to the sternum itself. So the posterior part of the xiphoid process, it attaches to the sternum يعني. The second place it attaches is the ribs. So it can attach to the sides of the ribs on the inside, the last few ribs. You know. Then the last attachment is to the vertebrae. Yellow to the vertebrae, it attaches by two ligaments, which we call al-crura, a left crus or right crus. Al-right crus, it attaches في I think L1, L2, L3, right? L1, L2, L3. While the left crus attaches to L1 or L2. تمام؟ دي basically attachment of the diaphragm.
Okay.
تمام. طيب. So ده كده كلام الdiaphragm يعني the things that are really important about the diaphragm. And as I said يعني mostly focus on the openings. تاني في الميدياستنم. يلا mediastinum is who, if you look at it in the book or in any PowerPoint كده, it's a lot, but most of the questions بتيجي من حتتين, من superior mediastinum ومن posterior mediastinum. Before I just go into details, I want to explain to you أصلا what a mediastinum is. A mediastinum is the area between a lungs. So if you look at the area of the thorax, it's between the two lungs. دي كده بنحسبها mediastinum. And we divide it into superior and inferior based on an angle of Lewis or sternal angle. اللي هو, what is the sternal angle? هو angle of Lewis. It's an imaginary line that we draw في sternal joint ذاته أو sternal angle ده, بنرسم line. يلا اللاين ده كده بيقسم لنا superior mediastinum من inferior mediastinum. تمام? So we draw an imaginary line at the sternal joint, which is also known as the sternal angle or angle of Lewis. And then we draw a straight line from it to the back. And that would be our superior and inferior mediastinum. So far good?
Yep.
Then the inferior itself is divided into anterior, middle, and posterior based on the heart itself or the pericardium. So anything in front of the pericardium would be the anterior. Anything that's inside the pericardium would be called the middle. And anything that's behind the pericardium would be called the posterior. So here we're going to four mediastina. The superior one, which is above the imaginary line drawn at the sternal angle, or the sternal joint, and below it, we've got the inferior, which is split based on the pericardium, if it's anterior to it, if it's in the middle, or if it's posterior to it. Now the important ones are the superior mediastinum, like the structures in the superior mediastinum, and the structures that are found in the posterior mediastinum. The middle and the anterior, I'll mention them really quickly, but they're not important. Okay. Right. Yellow superior mediastinum has a lot of structures, and it's the one with the most amount of structures. And it's really not easy to remember them. But the good thing is that usually they don't ask you to list. And they don't usually ask you to list them. They do ask you questions about the structures themselves though. So in some books, it's classified based on planes, like they say the glandular plane, the venous plane. In some books, they just mention the names randomly without a classification. And I prefer this classification because it just makes it easier for you to remember what's there. So there's a gland, there's some veins, arteries and nerves, there's viscera, and then there's lymphatics, right? So the glands, or the glandular, is a thymus gland. قاعدة في superior mediastinum وبرضه قاعدة في anterior mediastinum. تمام؟ في تاني الفينس, which includes the brachycephalic vein, the superior vena cava, and the azygos vein. And this one's really important. So the veins are very important to talk about. في تاني arterial nervus, which is basically arteries and nerves. It includes the arch of the aorta with its branches. معاه الphrenic والvagus nerves. And then we have the visceral, which includes the trachea and the esophagus, and the lymphatic, which includes the thoracic duct. Yalla, I know it might sound a bit difficult for you to remember it from the first time, but just think about it this way. Anything that's going from the neck to the thorax or from the thorax to the neck is going to go through the mediastinum, صح? And therefore it's going to go through the superior. Sorry guys, the sound went off for a second. سامعين كده؟
Yes.
Okay, I'll repeat. طيب, the last thing I said is إنه السفير mediastinum, imagine what structures are going to be in it. Just think of any structure that's going from the neck to the thorax or the esophagus or the trachea. They're obviously going to be, they're going to have to go through the superior mediastinum to get to the lungs and to the stomach. Right? The arch of the aorta located in this area exactly. So it would be part of the superior mediastinum with its branches. Tani, you're going to be thinking of any other vessel or any other artery that's going up or coming back down. The vagus and phrenic nerves, they're coming from the neck to the thorax, صح? And so on. So أي حاجة that's going from the neck to the thorax or from the thorax to the neck, it's going to be going through the superior mediastinum. That's why it has a lot of structures. I think it's not that difficult to remember, especially if you memorize it by classification. You know, we have a gland, 3 veins, arteries, and its branches, the whole arch of the aorta and its branches, 2 nerves, the phrenic or vagus, and then we've got the viscera, which are the esophagus and the trachea, and then lymphatics, which is the thoracic duct. Now, the esophagus and trachea, I'm not going to be talking about them at all. الثايمس برضو, we're not going to be talking about it, just as I mentioned. يعني لو بالغوا, they would just mention إنه the thymus is located when, which is located in the superior mediastinum and the anterior mediastinum. تمام؟ طيب? So these are like the things they could ask you about the thymus gland. ما أكتر من كده. الtrachea, الquestions حاجات usually are related to head and neck, not related to the thorax. Esophagus, I've never seen a question about it before, to be honest, excluding in the abdomen, يعني. So don't worry about these. تمام؟ طيب يلا نتكلم عن الفينز حقتها in شوية details. We're going to be talking about the brachycephalic or the branches of the arch of the aorta. هنتكلم عنهم بعد شوية, like in detail. Right. So the venous part or the veins, احنا قلنا عندنا brachycephalic vein on both sides. وعندنا superior vena cava وعندنا الازايجس. يلا احنا azygos اتكلمنا عنها. We talked about it earlier when we were talking about the ribs mush, and we're talking about the intercostal. Within the azygos, it drains all of the right intercostal spaces. Meaning left, it's drained by the hemiazygos. You know what happens is that after that, the hemiazygos and the azygos, they connect or they join to form الازygos بس. يعني الhemiazygos ذاته it drains into the azygos. تمام؟ وبعد ذاك the azygos. Is there a question? No? Okay. So وبعد ذاك the azygos drains directly into the superior vena cava. تمام؟ يعني الأزايجس vein starts. طيب يلا, there's sometimes in some rare situations they could ask you where does the azygous vein come from? يعني in general. The azygous vein starts from the right subcostal vein and معاها the right ascending lumbar vein. برضو it's a very rare question, لكن that's where it starts from. يعني السبكليفيان دي بتبدأ من ال right subcostal or right ascending lumbar, which are basically in the abdomen or right below the candle. You can look at the picture. This is the right ascending lumbar veins. This is the right subcostal vein. They'll join here and form the azygous vein. Then it'll go up until it meets the hemiazygous veins joining into it. And then the azygous vein is going to continue up until it reaches the mandibulosternal joint data, and behind it, it'll drain right into the superior vena cava. No? So this is basically a summary of what the azygous vein does. So azygous vein diamond is on the right, it's never on the left. And it starts right. Okay, I'll repeat. So the azygous vein, when it's on the right side, its job is to drain an intercostal veins. It starts in the abdomen or right في بداية thorax, where you join the right ascending lumbar vein with the right subcostal vein. They form the azygous vein, and the azygous vein goes up and ascends up until it reaches the superior vena cava, so that it can drain in the superior vena cava posteriorly. تمام؟ So it drains into the posterior vena cava, superior vena cava posteriorly. ده الازايجس vein. تاني, any questions about the azygous vein? Okay, I'll repeat it again. So the azygous vein, قلنا بتبدأ في like the abdomen or the ending of the thorax. So it starts with the right ascending lumbar vein and the right subcostal vein. They join together to form the azygous vein. And the azygous vein is going to ascend in the thorax, collecting venous drainage from all the intercostal veins. تمام? On the right side. On the left side, هيكون في hemiazygous vein, which also collects from the intercostals and then drains back into the azygous. So the azygous بيجيها من hemiazygous. And then the azygous goes up, still collecting more from the intercostals to drain into the superior vena cava. تمام؟ Got it?
Yes.
طب دي كده الازايجس. يعني الازايجس بتبدا وفي النهايه it drains into the superior vena cava. تمام؟ يلا نتكلم على البريكيوسيفاليك. البريكيوسيفاليك in the simplest way is formed by the junction of a subclavian والinternal jugular veins. So the subclavian vein and the internal jugular veins join together to form the brachiocephalic vein on the right and on the left. The internal jugular مع subclavian بيعمل لنا brachiocephalic. So unlike the arteries في الbrachiocephalic في الvein عندنا right to left. في الارتي بعد شويه هنتكلم عنها there is only one brachiocephalic, لكن في الvein في اثنين right and left. Then after that the right and left brachiocephalic veins connect together to form the superior vena cava. يعني برضو الbrachiocephalic eventually forms the superior vena cava.
معلش can you
تمام؟
repeat؟
طوالي. يلا الbrachiocephalic vein دي بتبدأ بشنو؟ بتبدأ ب right internal jugular vein و right subclavian vein بيعملوا لنا right brachiocephalic، أو left internal jugular وال left subclavian بيعملوا لنا left brachiocephalic. يعني في واحدة يمين وواحدة شمال بيجوا من السبكليفيان مع الانترنال jugular. اسمعوا لنا brachiocephalic right و brachiocephalic left. بعد ذاك البريكيسيفاليك الرايت والليفت هيتلاقوا and they'll join each other to form a superior vena cava. يعني لو زول سألك السوبيريور vena cava دي it's formed من شنو؟ It's formed من the two brachycephalic veins. تمام؟ طيب يعني في النهاية الفينس بلين ده كله في النهاية بيكب لنا في السوبيريور vena cava which eventually goes into the heart. الازايجس is gonna drain into the superior vena cava والبريكيسيفاليكس الاثنين are gonna form the superior vena cava. تمام؟ دي كده veins that are found in the superior mediastinum. طيب في تاني الارتريز. يلا الارتريز there's not much to talk about برضو it's not that يلا لا we don't say إنه الأزايجس forms the superior vena cava لأنه الأزايجس بيخش في superior vena cava بعد ما هتتصنع يعني بنقول إنه it drains into the superior vena cava. however البريكيسيفاليكس هم اللي بيصنعوه عديل so عشان كده we say إنه البريكيسيفاليكس form the superior vena cava. تمام؟ طيب يلا الارتري مختلفة شوية من الفينز لأنه في الارتريز عندنا بريكيسيفاليك واحدة بس يعني عندنا arch of the aorta ده وبيمرق منه 3 branches البريكيسيفاليك artery والليفت common carotid والليفت subclavian. تمام يعني الارتريز فيه 3 بس brachycephalic وليفت common carotid وليفت subclavian ما في left brachycephalic. تمام so there's only 3 not 4 3 which are أول واحد brachycephalic which is technically on the right but you don't call it the right one لأنه there is no left one and then في left common carotid والleft subclavian. They're كده the 3 of them they are the branches of the arch of the aorta. There's not much to يعني memorize here or much to like learn. It's just the naming حقهم أو إنه النيمينج حق البريكيسيفاليك is brachycephalic without a right وإنه البريكيسيفاليك دي في النهاية هتتقسم وتدينا ال right common carotid و right subclavian. no? Yeah. Good.
Yes.
فإذا عندي أي سؤال طيب آخر حاجة فيه المفروض يكون برضو النيرفز اللي هم الفيجاس نيرف والفرينك نيرف. يلا الفيجاس والفرينك نيرف there's not أنا ولا أقول حاجة كتيرة because برضو there's يعني usually it's asked about لكن not something that's needed in detail. What you need to know in Vegas is that the vagus is a cranial nerve طبعا وإنه it originates لا sorry إنه النيرفز حقت الفيجاس والفرينك الاثنين في الميدياستينم في واحدة passes behind the root of the lung وواحدة passes in front of the root of the lung. يعني it's a very important difference between them. إنه الفيجاس it passes behind the root of the lung. right? فهمت الحاجة؟ يعني الفيجاس بتمرق behind the root of the lung لكن الفرينك بتمشي in front of the root of the lung. يعني اللنج ذاتها الحتة بتاعت الهايلم of the lung في الاريا دي الفيجاس تطلع ورا والفرينك تمشي قدام. تمام؟ فيعني usually if you're looking this is actually useful لما تجي في ال DR. You know, when you're looking at the DR and they point you at a nerve and you don't know if it's a phrenic or vagus, just look at the lung. If it's behind the lung, it's a vagus nerve. يعني behind the hilum of the lung. If it's in front of the hilum of the lung, it's a phrenic nerve. ده if the lung is in the cadaver يعني. طب يا جماعة الزوم هيقطع، فأول ما يقطع بس a few more minutes ونخش تاني. تمام؟ نقول نخش تاني 8:30. تمام؟ 8:30 we'll start again. And if you guys have any questions, just جهزوها لحد لما نقطع.